Now, as if the pandemic is not enough, COVID-19 has created yet another crisis for the people. That is a mental health crisis. And when I say mental health, many might perceive this as a condition for the chosen few, but that isn't the case. People of all walks of life, including healthcare workers, children, those vulnerable, and even healthy people have been affected. So how have you been coping with the pandemic? Today, we delve into how the mental health stressors has affected the people, the response so far by the Kenya Red Cross Society, as we also give you tools on how to cope. All right, good evening. My name is Frederick Muitiriri and this is Frontline. Today in studio, I'm joined by a counsellor who has assisted those in Frontline and those who have been affected by COVID-19 since the onset of the pandemic. But before that, we take a journey from when the first case was reported in the country.
Persons with a cough or sneeze should stay at home or keep a social distance.
When the pandemic first hit the country on 12th March 2020, the first precautionary step the country took was to set up measures to curb the spread.
Regularly and thoroughly wash your hands with soap and water or use alcohol-based hand sanitizers.
Kenyans would look forward to everyday briefings on COVID updates. As the numbers were increasing, attention was paid. Protocols were followed to the latter as the tension could be felt. Some took to social media, putting on satirical face masks, while others blamed the government for not taking necessary precautions to prevent entry of the virus.
They ought to have done, which they didn't do, was to not to allow the Chinese citizens into the country.
Inaonekana kuna mahali ambao kuna kasoro na ni lazima sisi wote kama Wakenya tufikirie mara ya pili, kwa sababu kama mtu atakuwa na ugonjwa anaingia ataambukizwa watu wengine.
1 year down the line, a huge difference can be cited. Protocols are being broken left, right and center, forgetting what Health CS Kagwe once said: the disease will treat us abnormally if we treat it normally.
I think it's shame on the government. Shame on the government for coming up with solutions and ideas that do not make sense. We are tired, we are frustrated, we are hungry, and we want to go back to work. So urgently unlock our country.
The impact of the pandemic has been felt more in other parts of the world, especially India and Italy. This important tool that was meant to save lives is slowly being disregarded as the world craves to return to normalcy. Caroline Suma, Switch TV.
All right, thank you, Caroline. I remember that afternoon when the first case was reported, and I remember the worry that was in the country. And today on Frontline, I'm joined by Lona Karumba, a counsellor who mostly counsels healthcare workers. Welcome and thank you so very much for joining us.
Thank you.
Just tell us, as a counsellor, how crucial is it to offer counselling support to healthcare workers?
I think it's been very crucial, especially during this time of COVID.
Yes.
Because they have been struggling a lot with mental health issues. Sometimes breakdown, burnout, especially burnout because they've been working very long hours, and also feeling overwhelming because their families need them, we also need them, and they're also putting their lives at risk. And most of them have also been going into isolation because of all this. So because of that, they're not even able to connect with the normal family members that they're used to. Their wives are no longer with them, their husbands are no longer with them because they have to put themselves in a different room to protect the rest. So it was very, very crucial, and it is still very crucial. Right now, actually, we are doing more work than there was before because of the cases that are coming in and the amount of mental health issues that are coming up day in, day out. Yeah.
As a counsellor, what are the major reasons that they came to you and sought the help?
One of them is being very overwhelmed by the state of healthcare in the country.
The infrastructure themselves, or the healthcare
the healthcare itself.
System itself.
Yes, where you find there are like 10 beds, but in those 10 beds, they are accommodating more than 15 people, just to ensure that there is more space for each and every person, which means more work for them. So there's been that sense of, they felt overwhelmed, actually. That was a lot of stress, burnout, a feeling of, you know, will we ever rest? Will there ever be a time when we'll go back to normal, where they would even laugh with a patient, interact with them? Right now, they were telling, like, when they come into my office, they tell me the first thing that makes them feel very overwhelmed is that they have to go to a patient covered, all through covered, so they're not even able to interact with this patient. You come in, you do your work in less than 5 minutes, give the injections, and you leave. But they were used to giving a conversation to this person, trying to find out, who are you, what are you doing? That used to be the fun in their job. But right now it is so overwhelming, such that you've been given around 7 patients to do within a period of 2 hours, and you have to do those patients to ensure that by the end of the day you have at least helped as many people as possible. So it's that overwhelming. Some of them lost their jobs also during this time. Families, breakdown of families, where the families are like, okay, we can't take this anymore. So the wife,
you're going out every evening, you're coming back after 3 weeks.
3 weeks, and at that time when you come in, I can't even talk to you, because remember, you've put your life at risk, so you're put into isolation.
Oh, goodness.
So you find some of them coming in and telling you, my wife left with a child. One morning I just woke up and she wasn't there. I tried reaching out and she told me, you've become too busy for me. So families break down. Also a lot of abuse, verbal abuse, physical abuse, because of the stress they've been going through. They tend to feel like they are very angry. So we've been doing a lot of anger management techniques over the last period of around 1 year. So you find someone will come and tell you, I never used to be angry, but right now I snap at everything. So my wife comes in and tells me something, or my husband comes in, or my child comes in, and I slap them. And at some point I ask myself, what happened to me? Who is this? Who was this that actually was in myself? Because this isn't me. So those are some of the things that have been coming up as we've been doing counseling with these healthcare workers.
All right, and to keep this conversation going on as interactive as possible, we ask you on our question of the day, how have you been coping with the pandemic? How have you been coping with the pandemic? Talk to us via our hashtag is Frontline, that is on Twitter. Our social media handles Switch TV Kenya at Fred Muitiri. Or you can go to the SMS line, which is on 111 444 111 111 444 111. All right. I am with Lorna Karumba, and she told me she works for Counseling Starts With You. That's the organization.
Yes.
Counseling Starts With You. Have you been into a situation where you had to be isolated yourself?
Yes, we had to. There's a time, I think at the onset of it, there's a point where not really isolation, but more of trying to, as much as possible, to do counseling over the phone, because we were not able to see. Because most of the clients I personally was seeing were people who already had COVID. So of course the fear of, what if we come, we might also, we don't know if we are 100%. The fear of, yes, I might have had it and I could give someone else. Yeah, so we also changed. That was actually something that really affected us. We changed our counseling now from face-to-face to online, which is not very effective, but we had to. And then isolation also from family. Sometimes you find yourself, you're at home, but because of what you've gone through during the day, you tell yourself, you put yourself in that, you give yourself that conviction that, I need to protect the people around me. So that is by, staying in a room that is different, maybe trying as much as possible not to interact too much with the family during that time. And also as much as possible, trying as much as possible to ensure that I protect those around me. That is ensuring that if I go meet someone who has COVID or had COVID, then that way I'll be able to protect myself. Yeah.
Now, the pandemic is here to stay. It's here maybe for the next 2, 3, 5 years. What do we need to do? How do we need to protect ourselves, our mental health? What do we need to do as Kenyans?
First and foremost, we have forgotten, there's something that I keep saying, that it's not social isolation, it is physical isolation, keeping a distance. Not social isolation does not mean now you're not supposed to check up on your friends. So many suicide cases are in the country right now. Actually, just today I've received a call from a parent who has told me the son has just committed suicide. What am I trying to say? That this thing is there with us. And in as much as we are handling the COVID pandemic, we also have another pandemic. That's a mental health pandemic. True. And what is happening right now, people are diving into depression, as fast as, you know, hospitals, psychiatrists right now are receiving calls each and every minute for depression cases. We psychologists are receiving calls, help this person. And you know what is happening? We are receiving when it's already dire. It starts with at the onset. You're feeling stressed about something. There's something bugging you. Maybe there's something that has been on your mind throughout. What can you do? Reach out for help. We are here, and most importantly, there are even hotlines that help these kind of cases. And as much as possible, check up on your loved ones. Check up on those you love, because people are going through so much, especially families, because most people have lost their jobs. Most people, their families have been broken because of this pandemic. So check up on those people who you feel, I haven't seen this person. You see, even churches, we've gone back to church, but it's not 100%. Means people where we used to sort for that help, now people are not even coming to church. So check up on that person who you feel, wow, I haven't heard from this person for 2 months. They might be in depression. They may be going through stress. They may be going through suicidal ideations. So what is happening right now, especially in mental health stroke psychology, the docket, is that we are receiving a lot of cases where people are saying this pandemic, that is the cause of most of the problems. But it's because we were not able to reach out. Yeah, we were putting ourselves in a kind of isolation where we feel like we can do this on our own. No, we cannot do it on our own. We need help. We need people who can reach out to us, and at the end of the day, people who can come to us and tell us that, you know what, it's okay not to be okay.
All right.
Yes.
Thank you so very much. Thank you, Lorna, for joining us. The question of the day has been, how have you been coping with the pandemic? How have you been coping with the pandemic? We take a quick commercial break. We'll be back with more in a short while. And welcome back. If you're joining us, welcome to Frontline. On the second part of the show, we paint a picture of how Kenya Red Cross Society has been providing psychosocial support at the community level. However, mental health in Kenya continues to be a silent killer and a threat to not only the Kenyan population, but globally. In Kenya alone, 1 out of every 10 people has a mental health issue. As Faith Wambua explains, it is mostly witnessed in youths aged 18 to 29 years. Take a look.
In Kenya, it is estimated that 1 in every 10 people suffer from a common mental disorder. The number increases to 1 in every 4 people among patients attending routine outpatient services. Depression and anxiety disorders are the leading mental illnesses diagnosed in Kenya, followed by substance use disorders. Among the different types of substances, alcohol contributes to the largest burden of substance use-related illnesses in Kenya. One of great concern, alcohol abuse, is most prevalent in the 18 to 29-year-old age group. Mental health includes our emotional, psychological, and social well-being that affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Early signs of mental problems include eating or sleeping too much or too little, pulling away from people and usual activities, having low or no energy, feeling numb or like nothing matters, having unexplained aches and pains, feeling helpless or hopeless, and smoking, drinking, or using drugs more than usual. At this time, most mental illnesses cannot be cured, but they can usually be treated effectively to minimize the symptoms and allow the individual to function in work, school, or social environments. To begin treatment, an individual needs to see a qualified mental health professional. Faith Wambua, reporting for Switch.
Thank you, Faith. Now I'm joined by Christine Zilani under the Health Department of the Kenya Red Cross Society, who is going to help us break down how psychological support is provided by the Kenya Red Cross Society at the community level during this pandemic. Karibu sana.
Thank you, Fred.
Now, paint for us the picture of the response you got from the community as a result of helping them.
One of the responses is that the community now is aware where to access services, where to go for help. For example, we have the 1199 hotline, which is a 24-hour service manned by professional counselors. So when you go down there and they ask, where do we call? Who do we call? Whom do we talk to? Then we are able to tell them there is this hotline. It's manned by professional counselors from clinical psychologists, counseling psychologists, and medical psychologists. So you call there and you know somebody who needs help, then you will be assisted. The other thing is that they've told us that we have demystified mental health. In the community, there is a lot of myths and beliefs surrounding mental health. And of course, I would mention a few. There is those who believe it's witchcraft. There are those who believe it's a curse. There are those who believe it's for a certain group of people or community. But when you give them the facts, or when you give them the interventions, and they come to understand, then they know that that is not what mental health issues is all about, and we can actually be assisted, and people can cope and go about with their daily lives. And there is also the issue of the increasing coping skills through the stresses of life. We know that everybody goes through stresses in life, but our coping mechanism is different. So when we give them psychosocial support, or we offer psychosocial support through what we call psychological first aid. Communities have actually said now we feel we are able to cope with the stress that is weighing us down. We are able to offer each other, we are able to come together and form community networks, support networks, so that the other people can also benefit. Yes.
Now, how are you able to help the people at the community level overcome the mental health conditions at the community level?
I wouldn't really call them mental health conditions, but issues, because what is down there is something that is basic that can be offered by somebody who is not a professional. For example, we have community health volunteers who are sensitized and trained on psychological first aid. We have even...
what is psychological first aid?
It is a series of... it's an intervention that is... touching on the psychological, emotional support for people, so that they're able at the onset of a crisis or a disaster to make them cope at that immediate time. So when you offer that, when they really need it, then they are able to move forward. And it's also when you carry it at the particular time of the disaster, there's a sense of connectedness with the people who are undergoing distress at that particular time.
Just asking you, so you have community like psychosocial counselors? Yes,
they're trained in psychological first aid, but they are not professional counselors, because psychological first aid can be offered by anyone who is well trained and who has the skills, and these skills are look, listen, and link. Yes.
Look, listen, and link.
Look what is happening, what has happened. Are you seeing what the people are going through? Are you listening? Because you're not hearing. We're not saying hear what they're saying.
Yes.
They're saying listen with the heart. Because sometimes you can hear, but you're not really listening. And then we are saying link. Is there somewhere you can link them with? Maybe a family member, a service, or information. Because during a crisis, that is all they want. And if this is not given, then you find that they are very distressed and stressed, and their mental health is affected.
Okay. I want to ask this question. Allow me to ask this question. Basing on what you've been finding, because you've been coming into contact with these cases, how bad is it? How is the situation on ground, the mental health situation on ground? How bad is it? I give you 1 to 10.
I would say 1 to 10. I would say it's at an 8. 8. Yes.
It's that bad.
It is, and because not everybody speaks about it.
Yeah.
Again, there's stigma. You know, a lot of people, even in our workplaces, in our communities, in our neighborhoods, are suffering from have mental health issues, but because they're afraid to open
come
up.
Out.
Yeah, because they're
we Africans, we do not speak about issues that affect
stigma. And that is why even through our psychosocial support interventions, anti-stigma campaigns play a big role, especially at the community level. Remember, I know you remember when COVID was at the beginning. You remember when somebody was known to have turned positive, the way they would...
The stigma that followed.
The stigma, the isolation, you know, causing the family...
Even the families are told, don't go there.
Yes. So now all those things make others, those who are suffering, to not open up. But remember, again, I said we have the 1199 hotline, which offers that
anonymity.
Anonymity.
Yes.
Anonymity.
Yes.
And so they can call. And they don't need to say who they are. They only need to say
what they are.
Speak out. You know, and then it's also important for communities to understand it's okay not to be okay.
Yes.
It's okay not to be okay.
Yes.
But before we reach there, we need to stop stigmatizing.
It is hard for Africans for especially men, to come out and say, you know what, I have issues in my house. So how do you go about that when they call?
Actually, it's very interesting you've mentioned it. We were discussing this morning that at the beginning, from March 2020, the number of male callers was very low compared to female callers. Actually, it would be like around 40 to 60. But then as the lockdown continued, progressed, around June, July, the number of male callers started going up. And actually, as of now, you'd find they're almost 49, 51.
Wow.
Yes, meaning that even the community public awareness and education that is going on is actually opening up. They're bringing the sensitization, taking sensitization out there to all groups, you know, the youth, the children, the vulnerable institutions, even youth in correctional facilities have been reached. And of course, everybody, the general population, the affected, the infected, especially now with COVID.
They're speaking out.
They're speaking out. Men are speaking out.
That's
but
good.
we would wish that, you know,
more men would.
Yes.
Everyone would come out.
Everybody would come out.
Thank you so very much. We were speaking to Christine Zilani under the Health Department of the Kenya Red Cross Society for making time for us. Thank you so very much. So, we are taking a short break. We'll be back with more in a short while. Welcome to the last part of this segment. Now, we cross over to Mombasa County, where Leila Sekimo, a psychologist with the Kenya Red Cross Society, is with us. Now, Leila, kindly brief us on the state of the mental health in Mombasa County.
Currently, we are in a good state when it comes to mental health. At the beginning of COVID, when COVID hit, at the beginning, there was a lot of resistance towards mental health. The communities were not aware of what mental health is. And as Kenya Red Cross, we came in with several interventions to actually respond to the mental health issue and concerns in Mombasa. So I'd say currently we are at a better place than we were when the pandemic was beginning.
So what are some of those interventions that you had to come up with when the pandemic hit the country?
Most importantly, we had to actually step in and support the county governments with providing pre-test and post-test counseling and telecounseling services so that the people of Mombasa County can easily access mental health services. So among the other interventions would have been the community awareness sessions on mental health, whereby we would go to the communities and conduct these targeted physical sessions and sensitize them on mental health, what it entails, its signs and symptoms, and how to actually move around in seeking treatment.
Now, Leila, Mombasa County has been attributed with high cases of drug-related abuses. How have you come in and provided psychological support to these people during this pandemic?
Of course, with the pandemic, it brought about elevated levels of stress, worry, and anxiety, thereby aggravating every other situation like gender-based violence and drug and substance abuse. So we had to step in also as Kenya Red Cross Society, and some of the interventions would be targeting the youths when it comes to these mental health activities, whereby we would definitely sensitize them on generally mental health and substance abuse and disorder, maybe how to actually go through the rehabilitation process. We've also partnered with other organizations dealing with drug and substance abuse, trying to increase awareness that mental health condition.
And as we go on with this particular interview, we ask you, how is your mental health and how have you been coping during this pandemic? We've received massive feedback and we will answer you. This is how you tackle depression.
When you feel depressed, most of the times it's very important that to accept that you have depression so that you are able to know what to do. And one thing you can do is, for example, to seek help, like professional help, where, for example, you can as well call 1199. You'll have counselors there who can listen to you. Another thing, you can do some exercises, like you can as well do breathe in and out, whereby you get enough oxygen in your brain that, it brings a relaxation mood in your body. At the same time, you can as well do as well look for people whom you can talk to, so that you are able to share out what's happening, so you avoid so much to be alone. And also at the same time, it's very, very important to understand that you are aware of what is happening.
All right, those are tips for you. And now we are still with Leila, all the way from Mombasa County. And Leila, if you're still here with us, how has the pandemic affected the journey to provide psychological support to the population?
At the beginning of the pandemic, we realized there was a lot of panic, fear, and anxiety, because COVID was a new thing, and then it was affecting everyone, wherever you are, whatever class you are in. It was affecting the general population, not leaving out anyone else. So there's a lot of fear and panic when it came to COVID-19. Of course, also us as the mental health professionals, we kind of had that fear, but we had to step up, and actually provide the psychosocial support. I know mental health is a subject that was not really spoken about before the pandemic, but when the pandemic happened now is when it really impacted people's mental health, and now people started having conversations around mental health. It was hard at the beginning of the journey, but as we went along, there are several organizations, the government, several policies, interventions that were brought in place to actually address the psychosocial impact that came about with COVID-19.
All right. Thank you so very much, Leila, all the way from Mombasa, for making time and joining us from Mombasa County. And that, our viewers, marks and wraps up the show. My name is Frederick Muitiriri, and this is The Frontline. Till next week, Sunday, same time, keep staying healthy and safe. Good evening.